Hello, I'm Alfie Carlisle, and welcome to the Pulse from Heart. The Chancellor, Rishi Sunak, unveiled his spending and taxation plan for the country in the budget on Wednesday, announcing a continuation of many of the support measures that we have become accustomed to. Also in this budget, however, was a frank discussion of the public finances and a resolve to start to repay some of the debt accrued by lockdown firefighting. I'm joined today by Professor David Paton, a Professor of Industrial Economics at Nottingham University Business School, and Professor Marilyn James, who is a Professor of Health Economics, also at the University of Nottingham. Professor Paton, in economic terms, we know that GDP is expected to fall by approximately an annualized 10%, which has been said to be the largest drop in our annual output since 1700s. Is this proportionate, do you think, to the risk that we started off with from this virus?
Well, as you say, it's a huge drop in GDP, one of the biggest drops in recorded history, and of course that underestimates the cost of what's gone on, because we also have all the non-economic costs in terms of the upheaval to people's lives and the social interactions and so on. So it's a huge hit. In terms of whether it's proportionate, I think one of the frustrations I've had has been the lack of really serious analysis, both of the benefits of interventions the government's done, of lockdowns and business closures and so on, but also of the costs of those things. There's been this sort of almost exclusive focus on the virus, understandably to some extent, because we're all worried about people losing their lives and the tragic consequences we've seen. But any government decision has risks and impacts on people's health and potentially some benefits. Now, in terms of evaluating whether it's been a proportionate response, there's several things to bear in mind. One is that, of course, COVID itself imposes an economic cost. So when infections go up, people change their behaviour. For example, people are less likely to go to the pub, and so pub taking's a hit. So there can be an economic hit anyway. But then in addition to that, we've had the hit from the lockdowns and the business closures themselves. And without any doubt, those are very, very significant. So we can get some idea by looking at countries which have responded slightly differently. So you've got countries like Sweden, which had a very big hit from the virus, just like the UK, but took a different approach from a policy point of view. And their reduction in GDP has been much, much less than the UK, around about just under 3% in 2020. When you look at the size of the cost, the enormous cost to the economy, as well as the non-economic, the psychological, the social costs, I think it's quite hard to argue that it's been justified in terms of the benefits it brings. And one of the reasons I say that is that when you look at the data, as opposed to the models predicting what would be the impact of lockdown restrictions, most of the data suggests that the lockdowns and the business closures have at best a very limited effect in reducing infections and deaths and hospitalizations. But the much bigger effect seems to come from voluntary behavior change. When people see infections rise, you live with your granny, for example, you may be 20, but you're less likely to meet your friends because you're understandably worried about infecting somebody, so you don't go to the pub. Whereas if you're living in a student hall of residence, everyone's already been infected, and you're not living with vulnerable people, perhaps you do still go to the pub. What happens with a lockdown? Nobody goes to the pub. So the investment the pubs and the cafes and restaurants have in making things safer is lost, but all the economic activity is hit. But you really hit the sort of least risky activities, because the people who perhaps were at less risk anyway are the ones who now no longer go to the pub or the cafes and restaurants. So actually, if we were to pay attention to both the costs and the benefits of the intervention measures, I think it's very hard to make a case that they have been proportionate to the benefits they may have brought. Certainly, I think that the interventions we've had in the UK, for example, with this continual cycle of lockdowns, of restrictions, has certainly, I think, made things worse. So there's very little evidence, we've had some of the highest death rates in the world. There's very little evidence that these restrictions in themselves have had any benefits. So we saw, for example, the November lockdown, where things shut down for a month. There was virtually no impact that we could see of the lockdown on hospitalizations and deaths. Yet, of course, it has very, very big consequences for the economy and people's lives. So in that sense, yes, our interventions do seem to have made things worse. We can't say for sure that lockdowns and interventions have had absolutely no effect on the health crisis, but relative to the huge hit we've taken economically, psychologically, socially, it's hard to make a case that the benefits have exceeded the costs.
we hear a lot about Sweden. Are our economies quite alike that we can make that like-for-like comparison?
Yeah, I mean, every country is very different, and people often say, well, perhaps we should compare Sweden to its neighbours, Norway and Denmark. One of the differences with Sweden is that they seem to have a much higher attack rate of the virus early on, in a similar way to the UK did. So, whereas Norway, for example, had a very light lockdown, they also had a very light, effect of coronavirus itself. So Sweden is a little bit more similar to the UK in that respect. It's a much smaller country, of course, there's many differences, but there's other countries we can look at as well. Japan, another big country which didn't have a lockdown strategy. We've got states in America like Florida, which did have a lockdown strategy, but then in September changed, moved tack and said, right, we're no longer going to close businesses and so on. So I think we do have comparisons around the world, more or less, there's no perfect comparison to our country, but where we can see, there were different interventions. No obvious difference of those interventions on the progress of the virus or deaths, but certainly very different outcomes in terms of GDP and unemployment and so on.
Professor James, what's your take on the same point, really?
So there's been a massive rise in unemployment, so 5.1% up from to the end of December, and it's kind of hitting the sectors that were probably doing the best originally or before all this happened. So the whole of the hospitality sector. Granted, pubs have been in a kind of a precarious position for a few years, but hospitality itself was one of the big growth industries for the country. And effectively in the last year, pubs that were already struggling with economic measures, the number of pub closures have doubled from where they were at 2019. Unemployment's risen without a doubt, whatever measures we've put in. And obviously, it's closely correlated to the lockdowns and the economic impact and consequences of policies. And one of the biggest groups hit by that unemployment is the under 25s. So we think about the devastation done to students and then the interruption in their education. A lot of those same students would be taking part-time jobs in hospitality to supplement grants, and that's the industry that's being completely shut down with really very, very little justification that they have any contribution to infection rates. So I think the disproportionate targeting of sectors as well has been quite a sad outcome of this.
What would you say about the shift we're seeing to increased deliveries from the internet, for example?
Yeah, again, this is one of the very, very worrying factors of lockdown. So the government have locked down, and of course, people have turned understandably to online deliveries. So the likes of Amazon, for an example, have seen their proportionate market share go up and up and up in this crisis. And we're hardly on a level playing field. I mean, one of the kind of tenets of markets and fair markets was to have fair competition. And effectively, by introducing lockdowns, we introduce many of the factors that are required for monopoly. And I think we've all agreed as economists in the past that monopoly is quite a bad position to be in. It kind of forces out individuals. They can't compete with online retailers when we're not allowed to go to the shops. So the independent retailers are just not on a level playing field with some of these big online giants.
I suppose that also raises the question about taxes. I mean, we know that physical shops are subject to things like business rates. I mean, how do you take the news that as individuals and also as businesses, we're going to be facing essentially tax rises due to the personal allowance being frozen? How's that going to affect behaviour of consumers?
I think it's probably a difficult one to kind of judge before we're in it, but essentially, yes, we're all going to be worse off by tax freezes, effectively, which effectively is going to cut day-to-day earnings. At the moment, I guess there's very little competing for people's incomes, but when things are competing and when perhaps these poor struggling shops are going to go back, people are perhaps going to make more choices based on cost alone, whether that's a good choice for the workers whose conditions may be quite atrocious, and certainly not a good choice based on quality and a varied market. So I think there can be some very kind of hidden knock-on effects, really, of taking these approaches.
We hear quite a lot that sort of wealthy nations are healthy nations. Why is this, and how does this then impact public health? How are they linked?
I think that there's very, very clear links between deprivation and bad health. The most deprived will be the ones who don't seek health, will have very poor health behaviours, essentially always much worse hit. And also education, the worst educated population, least healthy the population. And again, these are well-established correlations. So we know that we've desperately put back education. A year or a year and a half of lockdowns that we've had and disrupted school and university education.
This suspension of education, you say it's a year. How long will those effects be felt into the future?
I think the impact of education has very long-term effects on individual both earnings but also their social capital. And we saw some research earlier in the year looking at the attainment gap from children of missing out on school for, as you say, for the best part of a year, being very, very significant, that they're falling behind where they should be in terms of achievement. Some of that may be picked up and brought back, but for children that have missed out big chunks of 2 academic years of their life, and that's quite a significant proportion. So, when we think of the long-term impact of education on economic and social wealth, we're likely to see the cost of that for years. There's some quite nice research published earlier this year by Katharina Janke and Carol Proper, looking at the impact of recessions, and they found that a 1% decrease in employment can lead on average to a 2% increase in chronic illnesses. So to put that in context, we saw now a similar recession that we saw in the 2008 crisis. We could be looking at just under 1 million extra people with chronic illnesses, perhaps 500,000 with mental health problems. It's a really very significant issue that we're facing for years to come.
I think just to pick up on David's point about mental health as well, I mean, that's the one area that we've seen escalate and escalate. I mean, I work on a number of clinical trials, and the clinical trials where people have been desperate to enter and desperate to enter recruitment have been the mental health trials. And the sad reality is that we've seen a gradual decline in spending on the health service over the last 7 years. So again, it's at the lowest level probably since the inception of the service itself in the late 40s. And yet suddenly the demands are going to be horrendous because we've got backlogs in elective surgeries, in the hips, the knee replacements that just haven't happened in the last year, but those problems haven't vanished. All those people will still need those hips and knees. And we already know there's huge waiting lists. There's certainly been a phenomenal expansion in mental health problems and mental health issues. And we know we've got a less spending on the health service. We've got less GDP coming in. So essentially, you've got this ever-decreasing cake with probably this ever-expanding demand in any area. The demand's been there, but it's had a capped supply because the area we've supplied is COVID.
Something which a lot of money we know was put into in the last budget and continues to be is the system of testing and the subsequent tracing.
The basic rule of economics, be it health economics or mainstream economics, is that everything has an opportunity cost. So every penny we put into COVID is a penny we claw away from something else, whether that we claw away from doing a hip or a knee replacement, or we claw away from supporting employment. So the more and more we pour into COVID, the less and less we have for the rest of the health budget.
That's absolutely right. And you look at the amount of money that's been spent on test and trace, for example, it's billions upon billions of pounds, which of course, as Marilyn says, has an opportunity cost. It's money we could have used elsewhere. When, there's a difference between testing somebody who's got some symptoms, and then you may protect, you may alert them to the fact they've got the virus and perhaps prevent further infection. But there's a real danger with the mass testing that we're seeing, for example, of school children and in some workplaces. All tests have false positives and false negatives. You can give false reassurance, but also with false positives, especially when infection rates are lower, you cause people to isolate with a big economic hit and a big social hit. You cause their close contacts to isolate unnecessarily. It's not just as easy to say, well, we'll test, we'll sort of break the chain of infection. You're spending a huge amount of resources, and it's not actually clear that you will break that chain of infection because of the false reassurance you may give, but you're also going to be causing people to isolate and with economic hits unnecessarily.
You mentioned, Professor James, about unemployment. What do you make of the way we've handled the system of job support, like the furlough system, which supports people's incomes? How does that compare to, say, countries that have used stimulus systems instead?
I think one of the issues with furlough is essentially it's not a stimulus system, so it's kind of helps to some degree people to stay employed. But I think we've all kind of said that once these furlough schemes come to an end, you already see blips every time there's kind of a hiccup in the furlough system, that the next announcement hasn't been made, unemployment rises a bit more. There was the announcement on the budget day, unemployment rises a bit more. So we kind of have this constant sort of zigzag of stops and starts with employers once they're actually asked to contribute to retaining employment, actually saying, no, this is the time to make somebody unemployed because I can't guarantee there's going to be this income stream or these jobs available at the end. So it kind of provides quite a false picture of where the economy is by kind of having this kind of this layer that makes us think, well, actually things aren't as bad as they are, but without really knowing what's going to happen when we withdraw them, because eventually we will withdraw them.
And on the point of sort of business continuity, Professor Paton, is now the best time to be going after businesses, for example, with these tax rises we heard in the budget?
Clearly not. The focus now has to be on getting things back to some kind of normality for those businesses that have been teetering on the edge. And many, as Marilyn said earlier, that we've lost thousands of hospitality outlets already and retail outlets. So the focus has to be on getting things, getting these businesses to survive. I mean, to be fair to the Chancellor, some of the tax rises are put down into the future, so they're not coming in immediately. But I think we've got to be so careful because we're going to have long-term effects of what's been going on. I think the furlough scheme has been successful, at least in dampening down short-term unemployment. There's no doubt that we simply haven't seen the unemployment that we might have done without the furlough scheme. But of course, the worry is what happens when things are relaxed. The real issue now, though, is that businesses need a bit of confidence and certainty. This is the issue for me. There is some money out there in the economy. There are people who perhaps haven't spent money on their holidays and so on, and are ready to go out to hospitality, to spend in the shops and so on. And I think quite a lot of businesses are reasonably confident that they can recover, those that survive. The worry for me, though, is that the government still, it seems to be reliant on their strategy of business closures and lockdowns and so on as a response to rising infections. And this is where I think the government could really improve what they're doing by saying, well, actually, we're not going to do that any longer. So we saw this with Florida back in September. They said, right, okay, we don't think that they're that effective. They really hit, business closures really hit the economy. We're not going to do it anymore. Even if infections rise, we're not going to shut down bars. And they kept to that, and infections did rise in Florida, no more than in other states that did have business closures. And now they've come down very significantly. Now, some people find it hard to accept the limited effects of lockdowns. It just seems so counterintuitive. They think, well, surely lockdowns have a big effect. You look at the data, I'm afraid they don't. But even if you don't accept that data, what we have now, we're in a very different situation because we've had the mass vaccination program of the vulnerable. So the argument before was that, well, we have to have this, these lockdowns and business closures to stop hospitals being overwhelmed, to stop having hundreds of thousands of people dying. Now, presumably, assuming the program is effective, we're not in that situation anymore. So when infections go up, and infections do go up and down, and I'm not a virologist, but I've no doubt that infections at some point will increase. What we need to see is government saying, well, actually, things are different now. Whether or not you believe lockdowns are effective in themselves, they're no longer a relevant policy given the situation where we're in. And I worry a bit that ministers are not giving out those noises. They're still talking about, well, if infections rise, we may have to slow down the reopening again. We may have to have more closures back in the winter. And I think now, actually, what businesses need to hear is, no, whether or not it was effective, what we did over the past year, we're not doing that anymore. That's not the right long-term strategy for managing a health crisis. It might be possible in a short-term emergency, but it's not sustainable in the long run. And that's really where I think the change of policy, but also messaging is really important.
No, I think it's that future planning as well, isn't it, Dave? Because, a lot of these decisions seem to have been taken almost on the hoof overnight. I mean, if you think about the first lockdown, and it comes up to one of the, not the only big spend weekend of the year, but one of the big spending weekends of the year, it was Mother's Day. Everybody was fully booked out. All the stock had been purchased. And then 2 days before, we get the announcement pubs are closed, rapidly followed, of course, by a national lockdown. That's a sunk cost, effectively, that cannot be recovered because the government's policy was to suddenly make a decision. And similarly with reopening, we've all seen this kind of roadmap that says, and here's the date for reopening this and this at the earliest. And again, these businesses need time to buy stock in, needs time to people allow bookings. I mean, I think the aviation industry say they need about 2 months' notice to properly gear back up to moving. So we can't have this moving policy feast and expect industry to respond, recover, whatever the sector.
What would you like to see change in the messaging tactics from the government?
I mean, first thing, the thing that's frustrated me right from the start has been their use of data to try and to present it in a way where they only present bad news. And clearly it's been a policy objective to try and put out information that makes the public take fewer risks. And that's understandable to a certain extent. But I think the danger is if you present data in a biased way, you lose trust. And when you lose trust, people don't necessarily respond in the right way. Most people, when they see high rates of infections and high numbers in hospital, they do change their behaviour, they take fewer risks. And as infections go down, perhaps they do take some more risks, but generally still in a safe way. There are people who won't, who will ignore the advice whatever happens, and there's probably not much you can do about that. But what I'd like to see the government do is move away from relying on the law, backed by criminal sanctions, ordering businesses to shut, or telling people they're not allowed to meet up, shutting down sport and social activities, moving towards a system of guidance, advice, giving information, not sugarcoating it, but when things are getting better, being honest with us and telling us that's a case, and then trusting people a little bit more to take the decisions that are in their best interests.
What I particularly like to see, I mean, my kind of one sort of real tenet that I would like reinstated is choice. As economists, we say that choice is kind of paramount, and that's the kind of almost one of the central tenets of economics, that people make choices and hence demand and supply go up or down dependent on people's choices. And we've kind of had choice taken away in this, completely taken away. So I'd like to see choice back in the hands of the individuals. And the kind of strange paradoxes that have surrounded COVID. If you look at the greatest killer, it's actually dementia. The position we put probably the elderly in is to completely accelerate that dementia because we've deprived them of company, we've deprived care homes of visits. Let people have choice again. People said the biggest way of preventing deaths would be to stop smoking. And yet, people have a free choice to smoke. If we cut out smoking, there's a lot of the health service costs gone. There's some weird paradoxes that I'd like to see kind of ended, really, and choice being put back in the hands of the individual. And as David said, there will always be people who make very irrational choices. Those who are scared, they're worried, well, whatever happens, they probably won't want to go out, and that's fine, but that's their choice. But let people who do want to go out and resume normal economics, to have the choice put back in their hands and taken away from perhaps policy or law or government a little bit.
Well, I don't know what you make of this narrative of the new normal, where we're going to be seeing apparently lots of people working from home now, and working days will be very different. I mean, do we need to get back into the office, or is this sustainable the way that we're currently all working?
That's been a very, very interesting phenomenon, hasn't it? And I think when you have a big change, you look at the way you've been doing things, and some things are for the best. So the fact that there's a bit more flexibility about working, and that you're not necessarily always sat in meetings face to face, may be something that's very beneficial for the future. I think what we don't want to say is, well, that's the only way of doing things. So for me, it's not just economic, it's social as well. This interaction, meeting people, talk when you're in the office, having a chat on the corridor or over a cup of coffee. But I think, yes, there are things that will go into the future, and we will do things slightly differently, and some things will be for the better. We've seen that in the way some GPs have sort of hastened the way to online and telephone consultations. Now, that can be very damaging. You want to see your doctor face to face, but in some cases, you want to get a repeat prescription, or you just want a quick bit of reassurance. It can save time on both counts. So yes, I think there can be benefits from what's gone on. The worry is, I think, if people look and say, well, you know, we're going to have to fundamentally change society in a way that our approach to dealing with health problems becomes one of, you know, the government taking control and deciding everything that we do, rather than, as Marilyn was saying, well, leaving some things as far as possible to individuals who perhaps have a better idea of our own circumstances and the risks we're willing and able to take. And I think that's what I'd would worry about if we move to something, you know, in the long term, to change how we deal with public health in that way.
So I think that there is a degree of benefit, but also basically productivity is kind of falling because we can't have those conversations that says, how do you do this statistical test? You kind of brood and brood, you spend hours trying to figure it out yourself, and then you wait a week to schedule a meeting with somebody. So there's definitely issues about lost productivity, even in jobs that we have been able to do online throughout this pandemic. And also, I think there's been a number of papers reporting recently about burnout. You know, but burnout's becoming a real issue on people who've been literally worked all the way through it, but have been stuck staring at the computer screens all the way through it.
I guess my question to the both of you now, and I appreciate it's a very, very difficult one, but what's the way out of this? How do we start to come out the other side of this crisis and rebuild economically?
I think the starting point for me has to be government recognising that this strategy of rolling lockdowns and business closures, it's not appropriate as a long-term strategy for dealing with a public health crisis. And whether they change by recognising that many of these interventions just don't have the benefits they think, or we accept, well, the vaccination programme changes things so that we no longer care so much about rising cases themselves. The government has to be clear, saying, well, we're not going to be using this approach in the long term. That will give businesses confidence. I think the government needs to be, at the worst, not delaying any of its opening up strategy. We can argue, you know, given the data we've seen and the improvements in infections and hospitalizations and so on, there's a very, very strong case for moving some of the opening up sooner, for allowing perhaps pubs and restaurants and cafes to open up in April indoors rather than just in May. But at the very least, the government must say, well, we're not going to be delaying any longer than we set out on the roadmap. It's time to give businesses confidence, allow them to be able to be sure they can plan and invest. And, you know, there, as I said, I think there is some confidence in businesses out there. So even though we've, I think, taken a damaging approach over the past year, you know, it's not too late to say, well, we can do things slightly differently. We can learn from those countries that have tackled the crisis, not by only shutting things down, and we can take a slightly different tack in the future.
One of the approaches is we need to recognise that there will always be a level of harm, whether that's from COVID or heart disease or cancer. We can't ever stop, sadly, all the harms in the world. And we kind of have to recognise that there's a kind of a background level of harm that we all need to accept and minimise risk if we can, but not at the expense of destroying society to do that. That one of the things we have to remove from the market now is the uncertainties that something prepares for a big Christmas opening and then the government shuts everybody down again. The uncertainty that we'll open in May, but oh no, actually the infection rate rose that month, we'll put it back to June. So we've got to take this level of uncertainty away from the markets and allow markets to recover properly on their own without so much government interference and manipulation of markets.